Right, okay, so this is your video for your massage. So we're going to go through all the common strokes that you're going to need to know and able to perform for your exams. So the first one that we're going to start with is just stroking, okay? So this is just initial contact with the dog. So it's nice and light, it's just getting them used to contact. One hand on, one hand off, and you're just maintaining nice and light contact. So we're not really moving the skin or the tissue, we're just getting the dog used to the hand. Next one is effleurage. So you can have two forms of this. You can have a light and then a deeper effleurage. So again, when you're demonstrating this for your exams, you need to do exactly as Helen's doing. So one hand on, one hand off. So you're in constant contact with the dog, nice and slow. So you can start to see that Helen's getting more movement of the tissue there. This would be still quite a fairly light effleurage, and then as you're going deeper, you can start to put slightly more force through your fingers and your palms of your hands, so you're just starting to get more deeper into the muscles. Normally you wouldn't do more deeper effleurage until you've done at least 2 to 3 minutes of lighter effleurage and warmed the area up first, because obviously the skeletal tissue is going to still be quite contracted and tight, so you want to make sure that you're loosening it off before you then go in deeper. The next massage that we're going to show you is compression. So depending on the size of the dog, you're either going to use 2 fingers, as Helen's doing there. You're going to press into the tissue and you're going to hold for 30 seconds, so you're getting that ischemic effect. And then once you've finished that, you're going to then take the pressure off. And then if you're treating a whole muscle, you're going to work down the muscle, coming on and coming off. If you've got a larger dog in your exams, so Helen will probably demonstrate this, you're going to use the palm of your hand, okay? As you can see in Bracken, that's quite large, and you're not just treating one focal muscle there, you're basically treating all her caudal muscles of her forearm, so that wouldn't really be suitable if you're asking to target a certain muscle. However, obviously in a large breed dog, such as Charlie that we use at work, you would be able to get away with that because you would still be targeted. The next massage technique that we're going to do is squeezing. So this is where you're just going to gently lift up a section of tissue, press and hold, and then release. So you don't hold this as long as compression. It's actually 1 to 2 seconds that you're just gently compressing the tissue and then releasing. Then the next muscle massage that Helen's just showing you there is how you can then obviously do it along the paraspinals. You can see there as well, because there's large, more looser amount of skin there, that you're getting more of a lift. So this is really good at taking the fascia and lifting it up relative to the muscle. So it's obviously very good if you're getting in areas of adhesions happening within injury. The next muscle massage that we're going to show you is hacking. So we're going to go on to more of our concussive percussion type massage techniques. So you're going to use these if you're going to want to provide stimulatory massage. You're going to do this more for neurological dogs, or maybe if you've got a sports performance. So this is where you're striking the muscle and you're getting a small muscle contracture. So again, it is very good if you've got a neurological dog, because you're stimulating that process, but you're also wakening up the muscle and getting some fresh nutrients into the area. And the next one is cupping. So this is where you're going to cup your hand like you're holding a bottle of water, and then you're gently going to cup over either a muscle, but the most common place that we use it in the dog is the chest region for recumbent patients. And you can hear, as Helen does that, you're getting that percussion on the chest there, and that's because her hands are nice and hollow. So you don't want to slap the dog with a straight hand, you need to make sure that you've got your hand concaved. Then the next massage that we're going to do is ringing. So you're going to slowly get the tissue to move relative to each other. So you can see as Helen does this, you're getting an S bend in the tissue, okay? So you've got both hands on contact with the dog, and as one slides forwards, the other one slides back. You don't need to, so if you were asked to do this for the paravertebral spinal muscles, you don't need to ring it so that you're basically moving one side of skin to the other side of the dog. You're just asking for a small section of skin to move, so you don't have to make it move large areas. So like Helen's showing you there, that you're just doing it very gently over the triceps, so you just get a small amount of movement there. Then the next one is skin rolling. So this is where you're going to pick up a section of skin, and what you're going to do is you're going to walk it up the dog. So you're going to pick it up between your thumb and your forefinger, as Helen is doing here, and just gently walk it up the dog. So you can see there that Helen's got the skin roll in between her finger and her thumb, and is just walking it up the dog. If at any point in your exams you feel resistance for this one, just gently just drop your hand and indicate to the examiner that the dog is resistant. So you normally find they're resistant and restricted over the lumbar region and between the scapular blades. So don't force it, because you can hurt the dog. It just indicates to the examiner that the dog is uncomfortable. And the last one is friction. So with friction, you need to indicate that obviously warm up is key. So you are going to warm up the area excessively with effleurage and deep effleurage before you perform friction. Then you need to place your hand in a specific position, so as Helen's showing there. So you've got one finger on top of the other, and then what you're doing is you're going in on a point and then you're going transversely, okay? So Helen's on the quadriceps here, which obviously runs proximal to distal, as she's indicating there. So to do cross fibre friction, she needs to go across the direction of the fibres, okay? You can also do circular cross fibre friction as well. So this is where you do it very, very slowly in a circular motion. So if you ask for cross fibre friction, either of these techniques would be suitable. Then this is different to what we're going to demonstrate now, which is cross fibre massage. Okay, so you could be asked for cross fibre massage, but that is where you're just basically going to massage across the fibre direction. Okay, so it's not cross fibre friction. With this one, you're just asking the skin and the fascia to move cross fibre relative to the muscle below, okay? So it's not the same as cross fibre friction. You're not trying to get into an area of tight adhesions and break it down. You're just trying to move the fascia and the skin relative to the muscle. And that's all your massage techniques that you need to know for your exams. So just remember, it's really important that you work with the dog either lying down or standing is fine. And obviously don't force the dog down into a lying position if they don't want to. Most of these massage techniques you can just do with them with sitting or standing.